Honesty and integrity are critical dimensions of professional nursing. Cultivating this in students during classroom and clinical experiences is vital. One way to approach this is identifying what might motivate dishonesty or lack of integrity and create a culture and environment that fosters honesty and integrity. In addition to reviewing these factors, we will contrast 3 examples of addressing honesty and integrity in the clinical environment. Before describing how to promote honesty and integrity, we need to identify what might motivate a student to act dishonestly or violate their integrity. Most individuals desire to be honest and have integrity, but there may be contextual factors that contribute to dishonest behavior. Some examples might include a desire to excel in a competitive environment, fear of failure in high-stakes scenarios, lack of clarity in responsibilities and assessment criteria, focus on perfection, poor study skills, lack of understanding about what is dishonest, lack of confidence, lack of ownership over class or clinical expectations, lack of consequences for cheating, and feeling unknown or unseen. As nurse educators and preceptors, we can facilitate environments that promote honesty and integrity. This might include demonstrating trustworthiness as an educator through consistency and integrity, utilizing low-stakes assessments, creating dynamic learning environments where students are able to connect didactic and clinical experiences, focusing on mastery and growth, getting to know learners, having clear boundaries, expectations, and consequences for boundary violations, cultivating a collaborative learning environment that facilitates student ownership over their learning, creating a safe environment to fail and learn from mistakes, and providing guidance about effective study and learning strategies. Please refer to our other videos for examples of incivility, accountability, and constructive feedback. Now we will compare 3 approaches to managing the clinical environment to support student integrity. The video vignettes will address a negative environment, responding to dishonesty, and preventing dishonesty. In all 3 scenarios, Maria, an APRN student in a women's health clinical rotation, is doing patient history taking and reporting back to her preceptor.
So I completed the history with Miss Alvarado, and she thinks that she may be pregnant. So she's taken 1 pregnancy test that was positive, but she would like to confirm this with a blood test. I asked if she's currently taking any birth control or if she's had any symptoms of pregnancy. She currently has 2 children, so this isn't her first time around.
Okay, what else?
I mean, that's about it. She wants to get a pap smear today. Her last one was 5 years ago, and she's only ever had normal pap smears. She has no history of breast cancer in her family, and she's only 35.
Is there anything else we're missing? Like a last menstrual period?
Yeah, I think she said it was about 6 weeks ago.
This is a basic piece of information that we need. You're gonna have to get this right if you're gonna be able to practice on your own. Let's go talk to her.
Now we would like you to reflect on what you have just watched and think through which strategies the preceptor could have used to help foster honesty and integrity. Strategies include through interactions, demonstrating trustworthiness, lowering the stakes, creating a safe environment to fail and learn from failure, focusing on growth, and facilitating student learning and ownership. Now we will go to our next video.
I completed the history with Miss Alvarado, and she thinks that she may be pregnant. She would like to confirm that today. She's taken 1 pregnancy test that was positive. She would like to confirm it with a blood test. I asked her if she's currently taking any birth control or if she's experiencing any symptoms of pregnancy. She currently has 2 children, so this is not her first time around.
Okay, what else?
I mean, that's about it. She wants to get a pap smear today. Her last one was 5 years ago. She's only ever had normal pap smears, and she has no history of breast cancer in her family. She's only 35.
Okay, great. Did you ask about her last menstrual period?
Yeah, I think she said it was June 15th.
We need a specific date because that helps us with planning her follow-up and care. Let's go talk to her. Maria, there's a few things that we need to discuss before we go see the next patient. So you told me Mrs. Alvarado's last menstrual period was June 15th, but when I verified it with her, she said it was May 30th. Can you tell me why there was a difference?
So I came up with that date based on my conversation with Miss Alvarado, but I didn't actually ask her that question. I was a little embarrassed about not having asked that question, and I didn't know how you would respond if I didn't have an answer.
Well, thank you for your honesty, but I want to remind you of our honesty and how important it is for every point in caring for our patients. We make mistakes, but it's really important that we own up to them and that we correct them because important decisions are made based on the information that our patients give us. So if you put the wrong LMP in the chart, maybe nothing would have happened, but it could throw off the due date. So many different things can occur. So we just need to make sure that we have the accurate information in the chart. So how do you think we can prevent this from happening again?
I think reviewing things before we go in to see the patient would be helpful. So if I forget something again, maybe I can go back in and ask.
I think that's a great start. You can also use the electronic health record to verify that you don't have any missing information or if you need to go back and verify something. So for the next few days, why don't we start by going in to see patients together again? And I'll be there for backup if you miss anything, and I'll also verify the information with the patient. And then once I have your trust back, we'll go back to you taking the history first, and then I'll follow up with the patients. How's that sound?
That sounds great. I'm really sorry that I broke your trust. Is there more that I could do?
So before you come in for the next shift, why don't you prepare a brief verbal presentation about how important the last menstrual period is in our patient's care?
I can do that. Thank you.
Now we would like you to reflect on what you have just watched and think through which strategies the preceptor used to identify and address dishonest behavior with Maria. Some strategies included noting and addressing the concern, so modeling integrity and trustworthiness, helping connect clinical and didactic knowledge, having boundaries and connecting those to consequences, lowering the stakes, focusing on mastery and growth, using collaborative learning, and creating a safe environment to fail and learn from mistakes. Now we will go to our last vignette.
I completed the history with Miss Alvarado, and she thinks that she may be pregnant. She'd like to confirm that today. She has taken one pregnancy test that was positive, but she'd like to confirm this with a blood test. I asked her if she's experiencing any symptoms of pregnancy or if she's taking any birth control, and she currently has 2 children, so this isn't her first time around.
Okay, great. Is there any other information that I need before I go in the room with her?
Yeah, so she wants to get a pap smear today. So her last one was 5 years ago. She's only ever had normal pap smears, and she has no history of breast cancer in her family. She's only 35.
Okay, great. We can definitely do the pap smear. So when we're caring for somebody who we think might be pregnant, what other information is important to their care?
That's a good question. Can I have a minute to think that through? Yes, we would want to know when she had her last menstrual period. I'm so sorry that I forgot that. Can we ask her when we go back in together?
Yes, definitely. It's hard to remember everything in the moment. So before I leave the room, I try to do a mental check to see if there's anything that I've forgotten. Maybe that might be a strategy that would work for you.
Yes, I like that. Thank you for sharing.
All right, let's go see Miss Alvarado.
Now we would like you to compare the 3 videos. In this third video, how do you think the preceptor fostered learning, safety, and integrity? Some examples included address the missing information and modeled trustworthiness through consistency and integrity by doing so, keeping stakes low, helping to connect didactic and clinical learning, focusing on growth, using collaborative learning, creating a safe environment to fail, and providing guidance about effective learning strategies. As nurse educators, we have opportunities to support our students and their growth or reinforce negative habits. Taking time and acknowledging the context of learning can help support learners in being honest and having integrity.